And thank you so much for returning and being here with us today on the Prevention Corner. Again, my name is Rich Coleman. I'm the host for the program. We are here with the fantastic staff of the VA hospital. And we just spoke with our director, and now we're going to talk with, this is Shawn D, who is with the Homeless Initiative through the VA hospital. One of the most important, we know here in Washtenaw County, our homeless shelter, which is very active here in the city of Ann Arbor, but we also have throughout our region a number of homeless personnel, and as we are discovering, as we work with them through law enforcement and emergency services, that a number of them are veterans. We want to make sure that we provide an awareness of how to contact the VA hospital, how they're working with the homeless, but also how our community outreach groups, our faith community, and all of those who work with various organizations will know how this service is available to them. Shawn, thank you so much for being a part of the program today.
Well, thanks for inviting me. I'm very excited to talk about our homeless veteran initiatives here with the Ann Arbor VA.
So talk to us about yourself first and your involvement in this role and how important it is to you.
Well, I've been working with the homeless populations for around 20 years, and to come to the VA and be able to work with our homeless veterans is an absolute honor. Mm-hmm. I've been with the Ann Arbor VA since 2007, and I've worked in the homeless program in all facets of homeless outreach to veterans, and have enjoyed serving our heroes.
Yes, yeah, absolutely. Yeah. So this program in the facility and its outreach initiative, we know that there are several series of programs and implementation between now and 2014.
Yes.
And the first phase of this, and I think with these two theater of wars that our personnel are coming back from, and our family members, and those who are already back because of either injuries or discharge and still are in that transitionary mode, what are some of the steps that we need to know about with accessing the services here?
Well, to access our services is really simple. Wherever a veteran who is experiencing homelessness comes in contact with the VA or a community provider, it's as simple as a phone call into our office. A veteran will call into our office, or a provider within the VA will place what's called a consult, and we'll contact that veteran within 24 hours and work with that veteran to either assess are they precariously housed, are they at risk of losing their home, are they actually homeless on the street, what is their situation, and then offer them services based on their situation. Mm-hmm. So if a veteran is literally homeless, say living on someone's porch or in a garage or in a barn, what we'll do is offer them a shelter bed in our catchment area here in Michigan. So we'll offer them within 24 hours, we can get you into a bed, and from that bed we can then work you into one of our housing programs. The VA offers treatment housing programs, such as what are called grant and per diem programs. Mm-hmm. We offer supportive permanent housing, so these are housing choice vouchers that a veteran can choose where they live and pay 30% of their income towards their rent. Mm-hmm. We have emergency service contracts for shelter beds, and then we have what are called transitional housing programs for veterans who have alcohol and other drug issues, and they work in a 6-month time period to get those stabilized and then transition into one of the other housing programs.
So it's a detox program in addition to transition?
Correct.
Okay. So the numbers, I know that some of the information that was provided, when we look at the total number, just one of the state of Michigan, I saw a number of 964
yes.
at the time, and I know that these numbers always fluctuate.
Yes.
Do we see them going to and from family environments or significant others back into homelessness and back? Is that recidivism consistent with a lot of our veterans dealing with a lot of the post-traumatic stress syndrome?
Yes. A veteran who is experiencing symptoms related to PTSD, as you mentioned, will go and engage with a family system, a support system, and once their symptoms are exacerbated beyond a certain point where the family may not know how to help that veteran any longer, that veteran will continue to isolate and alienate themselves from their support system. And as their symptoms continue to get worse and worse, they may end up in a shelter or living in an abandoned home or in a barn or a boxcar. And from there, our teams go out into these areas and talk with folks who are homeless, find the veterans, and work and build a relationship with that veteran with the ultimate goal of giving that veteran whatever that veteran needs in order to access services. Mm-hmm. We believe very strongly in veteran choice, and our VA-supported housing program allows a veteran to go right into an apartment no matter their homeless situation. They don't have to have a mental health evaluation. They don't have to have a substance abuse evaluation. They don't have to do anything but work to get their ID and their birth certificates and work towards getting into that apartment. Once that veteran is housed, we work with that veteran through that relationship and assist them in accessing any services that they feel they might need that would improve their quality of life. And eventually, the veterans will say, I would like to re-engage with my family. Mm-hmm. So there's a interesting dynamic that happens for folks. They come back to a support system, and when that system can no longer support them, there's a lot of folks don't have tools to understand, I can't help you any longer, and don't know to reach out for help. And so, when a veteran does come home and they may be decompensating or having difficulties with managing their day-to-day living, any phone call into the VA will get that veteran started in whatever services that veteran might be willing to participate in. Mm-hmm. So if a veteran comes into primary care for the first time, that doctor and those nurses are going to be screening that veteran for depression, for PTSD, and if flags go up, then those doctors make those referrals, and that veteran gets a call. Hey, here's a follow-up for your doctor. Would you be interested in these services? Keeping that veteran engaged is the key, and I'm very proud of the work that we do here at the Ann Arbor VA with keeping veterans engaged in their care.
Now, do you find that becomes difficult at times when families become really stressed and they're not sure what to do, and the pride factor, as I see it in a lot of situations where we are our own family, we can take care of our own, but it gets to that circle of where that's not possible anymore.
Right.
How do you break through that so that families know we are here for you?
So the first thing is we are there for them. Mm-hmm. I can give you a quick example if you would like. We have a veteran who, his father is a World War II vet, and he was living with them. He would go into their home and take a shower and eat, but he lived in a lean-to on a river in Toledo. And our veteran called one day, and no one wants to help me. He was very desperate. So he hung up on me, and I called him right back. And I said, I'm going to be where you're at right now. And we went and we picked him up and we took him to his parents' house. His parents were tired. They were tired. They had limited resources. They couldn't help him. And they didn't know what to do. So we brought the family back together, and in helping the veteran, he's a veteran that we put into the VA-supported housing program, and helping that veteran, we helped the family. We let the family know, here's our phone numbers. If you need help, let us know. If you need support. In supporting their son, we supported them. And so now he has an autonomous life, and he can go visit his family. He can be a son. He can be a soldier. He can be an independent man.
And do you find that there are times, because if they're homeless, they don't have access to a cell phone? They don't have access to, which are very few now, even payphones. Or some way to reach out. And that's great that you can working with the families. How we as community, if we know that we have a family member or a friend, and we know that they need help, and they saying, I'm okay, but is there a resource available for those family members and friends who want to reach out and help? Can they call as well and say, even though they're not a sibling or a relative, this is my friend, a lifelong friend that I know needs help. Is there a connection that will still work as well?
Yes. There's not only the number to our office, which is 734-845-5058, but we have a national homeless veteran hotline.
Yeah, let's give that hotline, because we're going to put that up on the
Okay.
screen as well.
It is 1-877-423-3838.
3838, fantastic.
And yes, anyone can call to our office. We often get calls from community members. I saw a veteran at the exit over on Getty's Road.
Mm-hmm.
Will you stop by and see him? We get calls from family members a lot, reaching out for help.
Mm-hmm.
I just don't know what to do. Can you come and help my son? So we're going to give folks any resources that we have. So we have VA resources and the resources within our communities. And we're also going to say, we would like to come out and visit with you. Reaching out, having that hand, extending that warmth and that being genuine with folks goes a long way.
Yes, yes.
To helping to engage people who are in a lot of pain. Mm-hmm. And that is the key to our work.
Because one of the things that as we do this program, and we're going to be reaching out to our faith leaders throughout Greater Washtenaw County, and the services that they can help with their members and their unique situations in every faith community. Being a pastor's son,
Okay.
I understand the dynamic that a family member will come to their pastor before they will go out of that circle to ask for assistance. Are there outreach initiatives to help faith leaders know how to reach you? And we're going to help do that as well.
Yes, we are.
And with this program and
Yes.
with other initiatives. But how important has that been?
It's been extremely important. I have done a number of speaking engagement with groups within congregations throughout Washtenaw County. Any pastor or group leader can call into our office to the 734-845-5058 number and request that we come out and speak to their group. It doesn't matter the day, the time, we will come out and do that. In order to end homelessness, we all need to be involved. Community members, community leaders, veterans groups. The faith-based community is a very important key to ending homelessness among veterans because of those important relationships. I found that in this community, the faith-based community not only has been able to bring together usable resources, like one group gave us backpacks with toilet paper, soap, stuff that a veteran would use on the streets. Other groups came in and we talked about what veterans' needs were, and they created their own support system, buddy system within their congregation, where people identified a homeless veteran or an at-risk of homelessness veteran, and they reached out to that veteran to assist them in establishing themselves. So they gave those veterans financial support, resources, things for their apartment, those kind of activities. Other churches have gone ahead and created a support group for families while their spouses were deployed. And even went as far as creating a buddy program for the children. A lot of them, their fathers were gone, so who was there to root for them at the basketball games and those kind of activities, teach them how to pitch and throw and shoot baskets. And so each congregation tends to have their own needs. And what we do is we go in and talk about homeless veterans and just in general what the needs are, and that church community, that church family begins to develop their own goals and objectives. In a number of the churches, I'm going for my third year in a row to visit with them because veterans' needs change.
Yes.
And so one congregation that I'm going to in April for the third year in a row, they're now wanting to know more about our Operation Enduring Freedom and Operation Iraqi Freedom veterans and how to be prepared as a congregation to help them when they begin to return home.
Now, one of the numbers that I saw regarding the age of the homeless veteran between 50 and 71.
Yes.
But that number in even some of the younger personnel from those two theater of wars is even going to come down a little farther.
Yes.